Hello and welcome to Easy Learning with Dr. Salman Khan. In this video, we study the Plasmodium species. These are the sections under which we study Introduction, Epidemiology, Habitat, Morphology, Life Cycle, Modes of Infection, Pathogenesis, Clinical Features, Laboratory Diagnosis, and Prophylaxis. First, introduction. The parasites belonging to this group of protozoa do not possess any special organs of locomotion such as flagella or cilia. They show only slight amoeboid change of form. They reproduce asexually by schizogony followed by sexual union or syngamy. This is known as alternation of generation. In case of Plasmodia, these two stages of life cycle take place in alternate hosts, so there is not only an alternation of generation but also an alternation of host. They live intracellularly at least during part of their life cycle. At some stages in their life cycle, they possess a structure called the apical complex by means of which they attach to and penetrate host cells. These protozoa are therefore grouped under the phylum Apicomplexa. Classification: Malaria parasite belongs to the phylum Apicomplexa, class is Sporozoa, order Hemosporida, and genus Plasmodium. The genus Plasmodium is classified into two subgenera. Plasmodium vivax, Plasmodium malariae, and Plasmodium ovale belong to the subgenus Plasmodium, while Plasmodium falciparum belongs to subgenus Laverania because it differs in a number of aspects from the other three species. Plasmodium vivax, Plasmodium malariae, and Plasmodium ovale are closely related to other primate malaria parasites. Plasmodium falciparum is more related to bird malaria parasites and appears to be a recent parasite of humans in evolutionary terms. Perhaps for this reason, falciparum infection causes the most severe form of malaria and is responsible for nearly all fatal cases. Then causative agents of human malaria. Plasmodium vivax causes benign tertian malaria. Plasmodium falciparum causes malignant tertian malaria. Plasmodium malariae causes benign quartan malaria, and Plasmodium ovale causes benign tertian malaria. By definition, it is the parasite causing malaria in humans. The name malaria is of Italian origin, where the word mal refers to bad and aria refers to air. This was given in the 18th century in Italy as it was thought to be caused by foul emissions from marshy soil. Malaria has been known from ancient times. Seasonal intermittent fevers with chills and shivering, recorded in the religious and medical texts of ancient Indian, Chinese, and Assyrian civilizations, are believed to have been malaria. Then history. The specific agent of malaria was discovered in red blood cells (RBCs) of a patient in the year 1880 by Alphonse Laveran, a French army surgeon in Algeria. In the year 1886, Golgi in Italy described the asexual development of the parasite in RBCs, which is referred to as erythrocytic schizogony, which therefore came to be called as Golgi cycle. Three different species of malaria parasite infecting man, that is Plasmodium vivax, Plasmodium malariae, and Plasmodium falciparum, were described in Italy between the years 1886 and 1890. The fourth species, Plasmodium ovale, was identified only in the year 1922. The mode of transmission of the disease was established in the year 1897 when Ronald Ross in Secunderabad, India, identified the developing stages of malaria parasites in mosquitoes. This led to various measures for the control and possible eradication of malaria by mosquito control. Both Ross in the year 1902 and Laveran in the year 1907 won the Nobel Prize for their discoveries in malaria. Then epidemiology. The incidence of malaria is more in poor population in rural areas, also in urban areas having bad sanitary condition. An epidemic can develop when there are changes in environmental, economic, and social conditions such as migrations and heavy rains following droughts. The relative prevalence of the four species of malaria parasites varies in different geographical regions. Plasmodium vivax is the most widely distributed, being most common in Asia, North Africa, and Central and South America. Plasmodium falciparum, the predominant species in Africa, Papua New Guinea, and Haiti, is rapidly spreading in Southeast Asia and India. Plasmodium malariae is present in most places but but is rare except in Africa. Plasmodium ovale is virtually confined to West Africa, where it ranks second after Plasmodium falciparum. Malaria may occur in endemic as well as epidemic patterns. It is described as endemic when it occurs constantly in an area over a period of several successive years, and as an epidemic when periodic or occasional sharp rises occur in its incidence. The World Health Organization (WHO) has recommended the classification of endemicity depending on the spleen or parasite rate in a statistically significant sample in the populations of children in between 2 to 9 years and adults. According to this, it is divided into 4 types. First, hypoendemic, where the transmission is low, the spleen or parasite rate is less than 10%. Then mesoendemic, where the transmission is moderate, the spleen or parasite rate is 11 to 50%. Third, hyperendemic, where the transmission is intense but seasonal, with spleen or parasite rate between 51 to 75%. And lastly, holoendemic, where the transmission is of high intensity, with spleen or parasite rate more than 75%. A global view of malaria: approximately half of the world's population lives in areas that are at risk of malaria transmission. Malaria is most prevalent in developing nations with tropical and subtropical regions of the world. Africa is the most affected area, with the most vulnerable persons being young children and pregnant women. And because of the high cost of intervention, malaria is a leading cause of death in many of these poor countries. Global efforts are underway to help control malaria and reduce the number of malaria-related cases and deaths. Control measures include the diagnosis and treatment of patients as well as prevention interventions such as insecticide-treated nets, indoor residual spraying, and larval and adult vector control. These efforts have led to a 45% decrease in malaria mortality over the past decade. In India, malaria is a major public health threat. About 27% population lives in high transmission, that is more than 1 case per 1,000 population, and about 58% in low transmission, that is 0 to 1 case per 1,000 person population area. In spite of decline of total number of malaria cases, the number of cases of Plasmodium falciparum malaria has increased. Self-reported prevalence of malaria in different states and union territories of India. The intervals represent malaria prevalence. The darker the shade, higher is the prevalence. Source is ResearchGate. Distributional prevalence of the 5 human malaria parasites in India as revealed with PCR diagnosis. Dots of different colors depict different malaria parasites either in mono or mixed infections. Source is Trends in Parasitology. The 6 sites involved in Center for the Study of Complex Malaria in India (CSCMI) studies since 2010 to the present date. The sites are indicated with red circles and the names of the institutions involved in the study are also indicated. Source: Trends in Parasitology. Next, vectors. Human malaria is transmitted by over 60 species of female Anopheles mosquito. The male mosquito feeds exclusively on fruits and juices, but the female needs at least 2 blood meals before the first batch of eggs can be laid. Out of 45 species of Anopheles mosquito in India, only few are regarded as the vectors of malaria. These are Anopheles culicyphasis, Anopheles fluviatilis, Anopheles stephensii, Anopheles minimus, Anopheles philippinensis, and Anopheles sundaicus. Next, habitat. The Plasmodium parasites are seen in the red blood cells (RBCs) in the form of merozoites, whereas they are seen in the liver, specifically the liver cells, hepatocytes, in the form of sporozoites and hypnozoites. Hypnozoites refer to the latent phase of the parasite, which reside in the liver cells. If you wish to see more of such videos, do comment below. And don't forget to like, share and subscribe to my channel. Also, press the bell icon for early notification of my new videos.